Okay, guys, let's get into it. So, tonight's topic is all about whether or not it's okay to discontinue using your CPAP, even if it's only for a short amount of time. So, I've discussed this over and over and over. CPAP is a struggle. It's super hard to get used to. There's a lot of complications that are involved with getting over the side effects and getting over that initial adjustment period of using a CPAP. And sometimes things crop up, like we need to travel, or we start having side effects, or we really just can't get used to that CPAP and sleep well throughout the night, where we start to think maybe I should take a little break from CPAP. But is that actually a good idea? Just to kind of give a general idea of whether or not it's ever a good idea to stop CPAP, it really depends on the situation. So if you feel like you need to take a break from CPAP, just to take a break, just to not use it for a while, you really don't have a specific health concern that you're worried about by using CPAP, your machine is still working, there's no issues with it, then it's probably not going to be the best idea for you to discontinue your CPAP for various reasons, which I will get into. Now, on the other hand, if you start having a lot of side effects from using your CPAP, or you've been using it for a while and you simply find that you're not sleeping soundly with CPAP, or it's too invasive, or maybe your machine breaks down. A lot of people are having issues with this horrendous Philips recall. So I can understand that a lot of people did have to take a break from their CPAP for a while. But if you do have to take a break from your CPAP, whether that's short-term or long-term, I'd just like to give you guys a little bit of an idea of what you can expect with your body, with your life in general, if you do take a break. So I'm going to talk about short-term issues that can crop up if you discontinue your CPAP, and also some long-term issues. Now, when I talk about short-term, I mean a few days to a week. Any longer than that, you're really going to start to have some effects on your health. Short-term isn't necessarily hugely problematic, especially if you have an end date to where you will be using your CPAP again. Taking a day or two off to get your CPAP fixed, or if you have to travel somewhere and you can't take it with you, is usually not going to be a huge deal. But let's just talk about some things that could happen in the short term if you did stop using your CPAP. So the first short-term issue you're going to run into if you suddenly discontinue your CPAP is you're simply going to get less deep sleep. So when I say deep sleep, I mean that really slow wave sleep where you're completely unconscious, and also a bit of REM sleep as well, so your dream sleep. Those are the two stages where you're really doing the most recovery at night. Your body is doing the most work to help you, feel well rested the next day. You're doing things like repairing tissues, repairing cells, releasing hormones, resetting your brain, resetting your entire body, really. So we do know that when somebody has sleep apnea and they stop breathing throughout the night, when their oxygen levels drop, when they stop breathing, their brain will generally wake them up so that they can recommence breathing and get their oxygen levels back up to normal. So even if you don't realize you're waking up, we call those micro awakenings, where you might only wake up for a few seconds and fall back to sleep. That process of your brain having to kick you out of those deeper sleep stages really keeps you from getting the deep sleep that you need. So this is why people who have sleep apnea, can sleep for a really long time, but they still feel chronically tired. And that's really because they're just simply not getting enough restorative deep sleep. So that's the first obvious thing that's going to happen. The second thing that you can expect to happen if you suddenly go off CPAP is you will get increased nighttime awakenings. And this goes back to what I just said. Every time you stop breathing, if your oxygen levels drop enough, your brain is going to wake you up to recommence breathing. Now, some people, like I said, will not notice these awakenings. They will be micro awakenings. Some people will wake up fully and, they may be awake for a few minutes. They may not be able to fall back to sleep at all, especially if you have overlapping issues such as having sleep apnea and insomnia. So when you are properly treated for sleep apnea, people just tend to wake up less in general, and they're able to sleep better throughout the night. So if you go off your CPAP and you notice that your sleep is very fragmented all of a sudden, that's probably because you're deoxygenating at night and your brain is trying to wake you up. The third short-term effect of discontinuing your CPAP, another obvious one, is you're going to feel sleepier during the day. You're going to feel more fatigued. And this goes back to the first 2 points. You're getting less sleep. You're waking up more often. So even if you feel like you had enough hours of sleep, you're still going to feel more fatigued than you would if your breathing was properly corrected by a CPAP. And sleep debt, so that lost sleep does compound over time. So, the first night off of CPAP, you might not feel so bad. But if you continue staying off your CPAP, you're going to build up a lot of sleep debt that you simply aren't going to be able to pay off properly because of your sleep apnea. Okay. Number 4, for the short-term side effects you can expect to experience when going off of CPAP briefly. So number 4 is going to be cognitive issues. And when I mean cognitive issues, I just mean how your brain functions properly. So you might find that your attention span is not as good as it usually is. You have a really difficult time focusing during the day. Your memory might be a little bit fuzzy. It might be harder to recall things you've learned previously. You may find that learning in general is just more difficult for you. And you may also find that your brain is just kind of foggy and not quite, as alert as you would like it to be. And this is, again, going back to just the fact that sleep apnea is sleep depriving. It sleep deprives you. So, even if a person didn't have sleep apnea, if they lost as much deep sleep and good quality sleep that somebody with sleep apnea has, they would also experience all of these symptoms. So, just keep an eye out for things like if you find that your attention span is really short, or you find that you're trying to read the same chapter over and over in your book because it's just not sinking in, then that may be a sign that your sleep apnea is starting to affect your cognition. Number 5 is mood, and we've touched on this several times already in my previous webinars. So sleep apnea has a pretty significant effect on your mental health and well-being. Being sleep deprived itself makes you less able to deal with stress. So the area of your brain that deals with stress and processes emotion really gets rebooted when we get into those deeper sleep stages. So when you're not going through that brain reboot every night, such as when you have sleep apnea, your brain is less able to handle, incoming stressors. So stimulus in your environment, problems that come up throughout your day. Your emotions also tend to take a deep dive because you're not releasing as much serotonin. That's one of your feel-good chemicals, and your brain's just not functioning properly. And unfortunately, when our brain stops functioning properly, one of the first things to happen is we will see a decline in our mood. Snoring. A lot of people with sleep apnea also snore. This is pretty well understood, and that's because the same tissues that can cause those obstructions in the upper airway can also vibrate when you do breathe, and that's what causes snoring. So you would likely see if you do snore, you will likely see your snoring return. Now, obviously, that's going to have consequences for you, like a sore throat or dry mouth. It's also going to probably disrupt your partner's sleep, so it's just something to keep in mind. And number 7 would be just general side effects of discontinuing your CPAP. So these are going to be things like morning headache, dry mouth, sore throat, increased nighttime urination, typical things that we see for people who have untreated sleep apnea. So those things can quickly come back into play when you're not breathing properly during the night. Okay, so we just talked about short-term CPAP discontinuation. That would be like if you took a trip or only went off of it a few days or a week. Let's talk about long-term CPAP. So it's pretty common knowledge that a lot of people get frustrated with using their CPAP, or if their machine breaks or if it gets recalled, they're going to go without their CPAP for a much longer period of time. This could be, several weeks to several months to years. And so it's not uncommon for me to hear from my clients that they just hated their CPAP, so they just stopped using it altogether. Unfortunately, the long-term effects are going to be a little bit more detrimental. Well, not a little bit, a lot more detrimental to your health. So it's just important to be aware that if you do need to go without CPAP for an extended period of time, talk to your doctor about alternative therapies. And like I said, I will get into those alternative therapies in a bit. So, number one is chronic health issues. So I've talked about this extensively in my previous webinars. Sleep apnea is strongly correlated with a handful of chronic health issues, primarily things like cardiovascular disease, especially, hypertension, and then, extensive cardiovascular remodeling, which means that it places a lot of strain and inflammation on the heart, and it can do damage to your cardiovascular system. Other things that are pretty common to crop up in people with long-term sleep apnea who are untreated, diabetes is super common. It increases your risk for certain cancers by up to 4 times. It places you at a higher risk for neurodegenerative disorders like Alzheimer's disease and dementia. And it also massively raises your risk for developing a mental health disorder, in particular, depression and anxiety. So, going off may seem more comfortable, but in the long term, it's going to be less beneficial for you to not be on treatment. And the unfortunate reality is that the longer you are off your CPAP, the more and more likely it is that you're going to develop these diseases. And it's not uncommon for me to see people with the beginning stages of hypertension all the way up to full-blown cardiovascular disease. So, keep that in mind. If you do have to go off of your CPAP for a really long time, pay attention to your blood pressure, pay attention to things like weight gain, and also pay attention to things like sugar cravings, because those are all signs of cardiovascular issues and metabolic issues that can occur. Okay. Number 2 is increased risk of accidents. So statistically, people with untreated sleep apnea are at a much higher risk of getting into any sort of physical accident. Most of the research has been done in motor vehicle accident and heavy machinery accidents. And that's simply because you're overtired. And we know that when you get to a certain point of sleep deprivation, it's basically equivalent to being drunk. So, you're at a state where if you're untreated and you're chronically tired, that you're really driving impaired. And we know that your risk of getting into an accident, which can either injure you, kill you, or injure or kill other people, is a lot higher. So, it's really important to be aware of that. It's really important to keep tabs on your fatigue and sleepiness before you get behind the wheel. Okay. 3, I just briefly touched on this, but mental health. So having sleep apnea increases your risk of developing a chronic mental health condition like major depressive disorder or anxiety disorder by about 50 to 60%. And the majority of people with untreated sleep apnea have some form of depression or anxiety in their life. It can also affect other mental health disorders as well, because mental health disorders are very, very sensitive to sleep deficit. So this can include anything ranging from attention deficit hyperactivity disorder, schizophrenia, autism, borderline personality disorder, you name it. Pretty much any mental health disorder is going to be affected by sleep. So if you've been off your CPAP for a while and you find that your mood has started to shift, or you're highly anxious, or you're starting to get some signs of depression, then that could be directly correlated to your inability to get a proper sleep at night. Okay, number 4 is effects on your work, family, and social relationships. So this is not really a surprise, but there have been many studies that have shown that people who do have sleep apnea that's untreated are at a higher risk for having poor workplace performance, at a higher risk for family issues, whether that's like domestic issues, or being able to participate in family bonding practices, and also social life. So, people with chronic sleep apnea are less likely to socialize and go out into the world. And again, this all comes back to just feeling poor during the day. So, you're sleep deprived, you may have some other health issues involved with your sleep apnea. It's just not a good combination to be able to function properly at work or in the home or in, your social life. Number 5, and I've talked about this pretty extensively before, but one of the most noticeable long-term effects of sleep apnea is unexplained weight gain. And I'll briefly touch on the science of why this happens, but sleep apnea significantly increases your risk of gaining weight and potentially becoming obese. So we know that weight and obesity itself can cause sleep apnea, but it's also the other way around. And this is because sleep apnea causes sleep deprivation. And we know when you're sleep deprived, your body basically goes into survival mode and starvation mode. So you'll start reaching for really high calorie, high fat foods that you wouldn't normally reach for if you were well rested. We also know that it really slows down your metabolism and your body's ability to control the hormones that control hunger and satiation, or that feeling of being full. So not only do you feel hungry all the time, but your body is also going to store a lot more fat than it normally would. So significant amounts of weight gain are not uncommon when you go off CPAP. Okay, number 6 is increased rates of infection. So this is infection from viruses, common cold, flu, COVID, really any virus. Other pathogens, so bacterial pathogens, so things like skin infections. You might find that your skin starts breaking out because you're more sensitive to the bacteria that causes acne. You might find that you start getting dental abscesses. And this is because of one thing that sleep really does need to accomplish is it strengthens our immune system, and it keeps your immune system what I call up to date. So it keeps your immune system familiar with those pathogens and helps it recognize that you need to fight off those pathogens. When you're not getting enough deep sleep, you're essentially depriving your immune system of its maintenance. And so you will find that you will have increased rates of colds, flus, infections, fungal infections. So really any pathogen, any microscopic organism that can cause infection, you're more likely to catch. So if you find that you start, your face starts breaking out, or you're getting a lot of colds, then it's probably a good indication that you're not sleeping properly, and that may have to do with not using your CPAP. And finally, this one's a little bit morbid, but early death. And it's a harsh reality of chronic sleep apnea that goes under control. We know that individuals who do not seek treatment and have long-term sleep apnea, their life expectancy is a lot lower than an individual who does receive treatment or does not have sleep apnea. This can be as much as 5 to 10 years off of your lifespan. And this really has to do with the effects that long-term sleep apnea has on your cardiovascular system. We also know that people with sleep apnea that's uncontrolled are more likely to go into sudden cardiac arrest, so a heart attack, compared to the general population. And that's even if you're, young, fit, and healthy. So it's a scary statistic, but it just goes to show how important it is to actually get treatment for your sleep apnea. Okay, so we've just gone through all of these things that can happen if you go off your CPAP in the short term and long term. Let's talk about let's quickly go over some CPAP alternatives, and then I'll answer some more questions for you. So if you have no access to a CPAP because your CPAP breaks or it gets recalled or there's a supply chain issue, your next easy option, and I've already talked about this before, is going to be an oral appliance that your dentist makes for you. The way it works is it sits in your mouth like a mouth guard. So you just put it in at night. There's no tubing, there's no wiring. And it pulls your lower jaw slightly forward, and that helps to keep your airways open. For best results, you should see a dentist that practices sleep dentistry. Generally, what they'll do is they'll look at your airways. They'll see if anything needs to be corrected surgically, like a tonsil removal or a tissue removal, and then they will fit you for a device, and they will adjust the device until you are sleeping properly and breathing properly. You may or may not need a referral to see a sleep dentist. Most sleep dentists don't require a referral. They may require a sleep study though. Not necessarily in lab, but they may use an at-home sleep test like a watch PAP or something like our company, Wesper. We actually partner with a lot of dentists, so it's not uncommon for them to just send you home with a device. So if you want to go down that route, first, you need to identify a dentist that specifically treats sleep apnea. And you can do this by going on their websites. They will almost always list that they treat sleep apnea and snoring, and contact them and just ask them about your options. Other options are going to be a little bit more invasive. So this would include surgical options. For some people, the reason they're getting the obstructions in their upper airways is because they have enlarged tissues. So this might be enlarged tonsils or turbinates, or a variety of other oral issues that can be surgically corrected. There are over 20 different surgeries available for sleep apnea, and it really depends on what is going on in your oral cavity and your upper airways that would, allow you to get that specific surgery. So you would need a full evaluation by your doctor. They would probably do some upper airway imaging. And there are benefits to surgery, like for some people, once they have the surgery, they're corrected. They don't have to worry about the sleep apnea again. There's also cons to the surgery. Healing from oral surgeries is quite taxing. It's not an easy process. And that's because, you're constantly talking, you're constantly breathing, you're constantly swallowing. So that puts a lot of stress on those tissues. And some surgeries are more invasive than others. So just talk to your doctor about whether you're a candidate and whether it's an option for you. Another therapy that is getting quite popular and that is being covered by more insurance agencies would be the Inspire device. You may have seen commercials for Inspire on TV. Essentially, Inspire is a little electronic implant that goes into your chest, and it runs a little electrode up to a nerve in your neck called the hypoglossal nerve. And at night, you turn your little implant on and off with a remote, and it stimulates that nerve. And the action of stimulating that nerve helps the muscles in your throat and neck maintain tone during the night. And when they maintain tone, it's harder for them to relax too much and collapse and cause those upper airway obstructions. Usually, Inspire is reserved for people with moderate to severe sleep apnea. Most doctors will not approve it for mild sleep apnea because mild sleep apnea can be treated by something like a mandibular advancement device. And then finally, positional therapy is an option for those with positionally dependent sleep apnea. So if you have sleep apnea on your back, but do not have sleep apnea on your sides, or you have severe sleep apnea on your back, but maybe like mild sleep apnea on your side while you sleep, you would use positional therapy, which involves using pillows and other devices to keep you off of your back while you sleep. This can be easier said than done, especially for people with pain issues, spinal issues, neck issues. It can take a while to get adjusted to sleeping on your side all night. I always recommend that you get a mattress that is made specifically for side sleeping. They do exist, or a memory foam topper is usually very helpful. Okay, so those are the most common options for CPAP alternatives. So if there's one that you're particularly interested in, talk to your doctor or see a dentist. If you'd like more information, just let me know. I can pass that on to you. Thank you so much for joining again. We'll have another webinar next week. Soon we'll be going into other sleep issues that are not necessarily related to sleep apnea, but can occur with sleep apnea. We're also going to go into more detail about those other CPAP alternative therapies. So if you're interested in learning more about the mandibular advancement device or Inspire, stay tuned. We will discuss that. If you have any questions or you would like to sign up to get notifications for our web series, feel free to send me a message on Facebook, or you can email me at Chelsea, CHELSIE, at Wesper, WESPER.co.